Hi everybody, Dr. Mandy here, getting on to talk about one of the things that we hear a lot in our office when it comes to hearing aid consults or post-fit follow-ups is I hear hearing aids can block out background noise. But before we get into all that, I want you to go ahead and find the bell on our YouTube page and click the button, and that way you'll get notified and you'll subscribe to our channel, so every time there's a new video out, you'll know. So, okay, coming back to the statement of hearing aids can block out background noise. There's a little bit of a myth to that, or maybe sometimes a little bit of a misconception about what hearing aids can and cannot do when it comes to background noise. What I explain to patients is our brain does all the work. The ears just channel the sound. So if you have normal hearing, or if you have hearing loss, and you can think back to years ago when your hearing was normal, the brain did all the work. So the brain has to separate speech from noise. So the brain has to hear everything. And we can't just block out background noise. You can get very aggressive with programming of hearing aids, where a patient can flip through a second program, maybe for a speech and noise program, where it will get more aggressive with filtering out the noise, but you have to manually put them there. But for me, if you get the right hearing aid technology for your lifestyle, the hearing aid does all the work. We hear everything in our world, but our brain just has to prioritize what's important and what's not important. And so if the brain isn't getting the appropriate speech signal from the hearing aid, or the technology level is maybe not the most appropriate for the lifestyle, it's that much harder for the brain to separate the speech from the noise. So it is very important that when you are going and consulting with a provider, that you get somebody that does the gold standard of real ear measurements. Because for most hearing losses, the lower tones, where there's background noise, vowels, and men's voices, those tend not to be as bad, if not normal, than the higher frequencies where the majority of the hearing loss is. So the majority of most people's hearing losses is going to be in the high frequency range, where we hear those voiceless consonant sounds, those SH sounds, those CH sounds. Those are the sounds that the brain needs to hear to be able to fill in the gaps of what the word is or what the sentences is. So if you do real ear measurements and you're doing what you're supposed to do as a provider, you're giving the correct amount of volume and processing at each frequency where there's hearing loss, because we need to get the brain to hear everything. The brain has to do all the work to separate it out. If you have hearing aids and you still feel like the hearing aids are just, your brain is not picking it up, it can't separate it out, and maybe that's what you're saying is, I just wish the hearing aid would block out background noise. Well, maybe you don't have the right hearing aid, or maybe you're not seeing somebody that actually does the gold standard real ear measurements to make sure that those hearing aids are optimally working for your lifestyle. Well, if you have any questions, give us a call. We can talk further about hearing loss and background noise, which is most everybody's struggle with hearing loss. We can certainly help. Now, we can also talk about more of those severe to profound hearing losses, where maybe hearing aids just don't help anymore, and at that point we might be more of a cochlear implant candidate, or maybe an FM system, assistive device sort of category. But I won't talk about that today. I'm just going to talk about generic hearing loss, where everybody says I hear but I don't understand, or when there's background noise I'm not picking up the conversations. That is basically what this video is about. So again, if you are a hearing aid user, you're having issues, or you're not quite sure your provider did the right amount of programming, or just in general you want more information about how the ears work with the brain, we can certainly talk about that. So give us a call at our office at 605-306-3050. We have 2 locations. We have one on the southeast side of Sioux Falls, and we have a second location out by Lake Madison. So have a great day, and we'll talk to you soon.
We are here to help. If you want to chat with Dr. Mandy, go to Sioux Falls Audiology Associates.com.